let's discuss about different types of deceased donor kidneys. Now, when you're on the wait list for a deceased donor kidney, not every organ offer is exactly the same. You might get a call about a kidney with a special label like expanded criteria donor or increased risk donor,
now formally called an exceptional distribution donor.
So let's go over what those terms mean and what you need to know if one of these kidneys is offered to you. First, not all deceased donor kidneys come from young, perfectly healthy people. Some come from older donors or donors with certain health conditions, but they can still be good kidneys that offer years of function. The term standard criteria donor usually means that the donor was younger and has had no major health issues that might affect the kidney. These kidneys are expected to last the longest, all else being equal. Expanded criteria donor or ECD means the donor was older,
over 60 or over 50 with at least two of the following: high blood pressure, death from stroke, or mild impairment in kidney function.
These kidneys may not last quite as long as those from younger donors, but they can still work well and offer 8 to 10 years of life off dialysis. That's a huge benefit. Many patients choose to accept an ECD kidney, especially if they're older themselves or have already waited a long time. Accepting this kind of offer can mean getting transplanted sooner, which often improves quality of life. Think of it like choosing between two used cars. So one has 80,000 kilometers, the other has 20,000. The one with more mileage may not last as long, but it's available now and might be just what you need. Saying yes to an ECD kidney doesn't mean you'll give up your chance at the younger donor, but it adds more options while you wait. Now let's talk about increased risk donors.
You may also hear this called an exceptional distribution donor, and this is the newer official term. These donors have a medical history that may carry a very small but increased risk of transmitting a cancer or an infection.
Now, this term often sounds worrying and scary, but it's not. It's often misunderstood. It doesn't mean that the kidney is poor quality. In fact, many increased risk donors are young and healthy. The risk refers to certain behaviors or situations in donor's history that could slightly increase the chance of an undetected infection like HIV or hepatitis. Examples include recent IV drug use, incarceration, or high-risk sexual activity. But here's what's important. All donors undergo very sensitive testing, including genetic testing for viruses like HIV and hepatitis, and these tests can pick up infection just days after exposure. The actual risk of transmission is extremely low. So why consider a kidney from an increased risk donor? Because many of these organs come from young and otherwise healthy people, and they may work better and last longer than a kidney from an older standard donor. You get a low risk, high functioning kidney, often with a shorter wait time. You'll be told the reason for increased risk label, and you'll be tested again after transplant to confirm that there is no transmission. And even in the extremely unlikely case of infection, we now have effective treatments for HIV and cures for Hep C. Speaking of hepatitis C, some programs even transplant kidneys from donors who were known to have hepatitis C into patients who don't. Now, this is done with your permission only, and you'd be treated afterward to cure the virus. It's not part of the increased risk donor category, but it's another way we're expanding the donor pool. So what happens when one of these kidneys are offered to you? The transplant coordinator will call and tell you the donor's age, any relevant medical history, the kidney's lab results, and whether it falls into any of these categories. You'll need to make a decision fairly quickly. Offers move fast. That's why we're discussing this now, so you can think through your preferences ahead of time. Some patients say, I'm fine with increased risk if it means a younger kidney, or I'll accept an older donor to get off dialysis sooner. Others say, I'd rather wait for the best possible match. All of these choices are valid. You are always in control. Just know this, saying yes to a kidney with one of these labels could mean getting transplanted years sooner. That's years off dialysis, years of freedom, and often excellent kidney function. No matter the label, your transplant team carefully evaluates every kidney. They will only offer you something they believe is safe and suitable. Their goal is same as yours, a successful transplant and a healthier future. So while some donor kidneys come with more background details, many still provide excellent outcomes. Being open to different kinds of donor organs may give you more opportunities and help you get transplanted sooner, but the decision is always yours.